Acupuncture, an affordable and effective solution. The severe burden of U.S. healthcare costs. Healthcare costs in the United States have become a heavy burden on families, businesses, and society. Despite having the highest per capita healthcare expenditure globally, overall health outcomes have not corresponded to this level of spending. According to data from the Organization for Economic Cooperation and Development, OECD, in 2019, U.S. per capita healthcare expenditure exceeded $11,000, with total healthcare spending accounting for nearly 18% of GDP, a figure that continues to rise. In 2020, the average annual health insurance premium for a typical family surpassed $20,000. Even with insurance, patients still face high out-of-pocket expenses, pushing many families into financial distress. Prescription drug prices remain exceptionally high, significantly exceeding those in other countries. Many patients are forced to forego essential treatments due to the unaffordable costs. Unequal distribution of healthcare resources further exacerbates the issue. Residents in rural and remote areas struggle to access timely and high-quality medical care. Low-income populations and minority communities face even greater barriers to healthcare access, resulting in poorer overall health outcomes. Acupuncture, a cost-effective healthcare solution. Faced with rising healthcare costs, the U.S. urgently needs a more affordable and widely accessible medical solution. Modern research has validated acupuncture's effectiveness in pain management, chronic disease treatment, and mental health improvement, while also reducing reliance on expensive medications and surgeries. Acupuncture is significantly more affordable than traditional medical treatments, helping patients save on healthcare expenses while reducing the overall burden on the healthcare system. Expanding access to acupuncture, particularly in rural and underserved areas, can optimize resource distribution and provide high-quality, affordable healthcare for low-income populations. Advancing acupuncture legislation for better healthcare access. To maximize its benefits, policy support is essential, including insurance coverage for acupuncture and legislative advancements. Public awareness must also be increased to ensure that this proven therapy reaches more people. The U.S. healthcare system requires innovative solutions, and acupuncture is one of them. Let's work together to promote acupuncture, improve public health, and ease the burden on our healthcare system.
Abbott Northwestern is the first hospital, not only here in Minnesota, but the entire nation, to offer acupuncture in the emergency room.
We're back now with new hope in the battle against the rising epidemic of opioid addiction in this country. A new study is revealing which alternative treatments can relieve pain with fewer prescription pills and possibly without pills at all. NBC's Dr. John Torres explains.
Judy Moran, a lawyer in New York, has suffered neck pain for 3 years.
It's very, very debilitating. Almost some days unsustainable in terms of tolerating it.
After trying almost everything, she found relief with acupuncture, which stimulates certain nerve endings.
Acupuncture can cause you to feel pain differently.
And it works for a lot of Americans, according to one of the most comprehensive studies of alternative pain relief. Today, the National Institutes of Health, reviewing findings from more than 16,000 patients, reported on what works and what doesn't. For those with arthritic knee pain, acupuncture and Tai Chi had the best results. And back pain, it's acupuncture and yoga.
I didn't feel there was any way out.
Judy swears by acupuncture.
Does it hurt?
No, it does not hurt. You know that someone's touching you, but it's not like getting a shot.
Just bending your knees.
Insurance companies don't always pay for these therapies. Pain experts hope this study proves they do work and should be covered. Dr. John Torres, NBC News, New York.
A new study headed by researchers at Memorial Sloan Kettering Cancer Center and funded by the National Institutes of Health found the treatment can be effective in reducing chronic pain.
And makes the rounds looking for someone seeking pain relief. Since the study started in 2013, a majority, 89% of 850 patients, have been willing to give acupuncture a shot.
We're actually seeing less use of opioids in the ER when people receive acupuncture.
He says 20% less, saving.
Acupuncturist Christiane Schultz is preparing to treat Sarah, who's complaining of neck tension and indigestion. In this emergency room, instead of offering painkillers, Schultz is administering the ancient Chinese medical practice of acupuncture.
Acupuncture has been researched for pain, so it stimulates the pituitary releases endorphins, and endorphins help with pain.
A recent study by the Penny George Institute for Health and Healing found that ER patients who receive acupuncture experience significant reductions in pain and anxiety. Since April, St. Francis Medical Center's emergency room is the second in the nation to offer acupuncture for things like migraines, nausea, anxiety, and pain.
How are you feeling?
Good.
Good.
And it feels more relaxed. I had some chronic neck and migraines, and it's helped with that too. I feel better. I need to take less medications.
St. Francis officials say they hope acupuncture will replace opioid prescriptions for many patients. They say 91 Americans die every day from an opioid overdose.
Less chance of somebody having an addiction. I mean, acupuncture, you don't have the effects that opioids can sometimes pose.
The hospital also says it will save patients money.
Acupuncture at St. Francis here, it's a service to the patient. There's no cost to the patient here.
As for the experience of needle pricks all over the body,
it's not painful. I mean, right now I don't even feel that they're there.
In Shakopee, Ivory Hecker, KARE 11 News.
This is Dr. Yemen Chen, the president of New York College of Traditional Chinese Medicine. I want to share the information about acupuncture treatment for migraine headaches through the document of consensus statement on acupuncture by National Institute of Health in 1997. This is a landmark conference for acupuncture profession, and also the documents from the World Health Organization also show the efficacy of acupuncture in the treatment of migraine. The scientific paper published in recent 2 decades has significantly increased. One of famous scholar, Dr. Andrew Viker, has published his article in British Medical Journal in 2004. And for the efficacy of headache, especially migraines, and after acupuncture treatment, patient will experience less episodes and less medication, less visits to their doctors, and fewer days of sick from work. This is high quality systemic reviews. It reviewed 15 articles published in medical journals, and I found a high quality of evidence that the effective rate of acupuncture was superior to Western medicine in treatment of migraine. This is another important document published by the Cochrane Library, which is the headquarters of evidence-based medicine. The white paper published in 2016 showed acupuncture for the prevention of episodic migraine. Acupuncture not only can dealing with the symptoms during the migraine episode, it also can do the prevention. And this article for the acupuncture migraine prophylaxis is a randomized control trial, and the data showed a significant reduction in the number of days with migraine. Another important article published in a high-quality medical journal, JAMA, Journal of American Medical Association, and its internal medicine subjournals, and show the acupuncture significantly reduced the frequency of migraine attacks. And this is another one show the reduction of mean number of attacks for the migraine prophylaxis. So it is very potential and used in the clinically for pain management, and acupuncture is significant for prevention of the migraine headaches. So I strongly recommend it to the public.
Hi, my name is Yan Dongwu. I'm a nurse. I'm also a nurse practitioner student in Long Island University. I don't feel like to do anything. I don't feel like to see my friends anymore. So I don't know what's wrong. Maybe just a little bit depressed. Then I talked to one of my friends. She's also my colleague, and she recommended me Dr. Lee. So actually I started treatment last year, but at the beginning I don't really feel like to do acupuncture because I don't like the feeling, so I stopped. But this year I feel like I really need to do something to make myself feel better at least. And then I start treatment. It's been I think 6 weeks now. So I come here every Saturday. So so the biggest improvement for me is like every day after I get off the train, I have to climb the stairs. I used to be like very short of breath, but now I do notice that it's a big improvement for me. And also, yeah, my friends told me I seem like much happier, and yeah, and I also feel like to exercise again. I have a yoga class this afternoon. So I don't stay home anymore. Like even though it's cold outside, but I still feel like to do something. That's a big improvement for me, and I'm happy of this. Thank you so much.
Hi, I'm Nancy Colley. I am a professor emeritus of ophthalmology, genetics, and neuroscience, and I've been receiving treatments from Dr. Joe for 30 years, and I highly recommend him for health and wellness. I recommend acupuncture as well as massage for health and well-being. It has assisted me with many challenges through my life, and I really highly recommend for Medicare and Medicaid and other funding agencies to support the coverage of acupuncture and meditation.
Okay. My name's Paul Novak. I've got a PhD in educational policy studies. I've been working with Dr. Joe for almost 30 years. I was teaching at his massage school, but I've also gotten acupuncture from him often. It's been used for various maladies. And so what I really hope is that acupuncture and massage therapy could all be put under Medicare. A lot of people would benefit if that was a possibility. So I urge people to work on that.
Hello, I'm Dr. Lynn McDonald. I'm a professor emeritus of social work, and I've had acupuncture for many years. It has helped me through many different illnesses, and as well as depression, as well as helping me to stop smoking, as well as helping me to lose weight. It has many positive functions, but especially pain reduction. So I highly recommend it, that it be covered by Medicaid and Medicare and insurance companies in the United States. Thank you very much.
Where the most pain? This is actually the spot. Can you rotating? Left side, yeah. Any pain? No? Yes, a little bit here. Little bit there. Okay, yeah. Other side? No okay. Pain. No. Let me see, okay? Extension, let me see. You can do like that, huh? Okay, I can do it. It's already tension here. Okay. Now flex it, extension, please. Oh. Do your best. Oh, good. Okay, 1. So, extension. Touch, touch. 2. Good. Okay. 3.
Wow.
So now you do taking this side and then going to the right. For 1 now, you use the discomfort, right? For 1 now.
A little bit. It's better.
It's better, right?
It's better.
Before when you do that,
Uh-huh.
it's pain here.
Right.
For 1 now, you do it.
Uh-huh.
No pain.
No,
Oh,
no.
Good. See?
My name is Sandra. I would like to share something amazing with everybody. I was Western educated and I never believed in Chinese medicine or acupuncture. One day, a friend brought me over to the Skin Lake. I have been taking omeprazole in the last 10 years for my mischievous stomach. I would be having cramps any time of the day, any time of the night. I wasn't able to drink coffee and I wasn't able to enjoy my hot chili sauce. Dr. Lee gave me acupuncture treatments in November 2022. By February 2023, I am totally cured. I don't have to take the medicine anymore. Now I can drink coffee morning and night, 3 or 4 cups without taking the above medication. I endorse acupuncture.
Hello, my name is George. I'm 41 years old. I work in the Nanshan Development Center. I'm a safety director, maintenance technician. The reason I'm recording this video is to advocate for a central plan for the acupuncture. Acupuncture is expanding access to better health. Acupuncture is actually a safe and effective traditional therapy that helps relieve chronic pain, improve physical and mental well-being, also reduce dependence on medications. However, in New York, essential insurance policies do not yet cover acupuncture, preventing the acupuncture from accessing this natural side, effect-free treatment. We urge Essential Plan to expand its coverage, including acupuncture, allowing more patients to benefit from its proven health advantages. Myself, I have, I have a surgery, heart surgery. After surgery, I've had numbness in my feet. So acupuncture is a form of treatment that can help relieve these pains that I am experiencing. So this is why we're advocating for acupuncture to be covered in essential plans for insurance companies. Also helps reduce financial burdens on patients, lower dependence on opioids, and improve chronic disease management. This also promotes insurance equity, making traditional Chinese medicine and acupuncture something affordable for healthcare solutions. Thank you.
Hello, I'm Simon. I am the patient in this clinic. Just 1 year ago, I had a serious skin matter that was black and white all over my face. That caused me depressive. I could not go to work because of this black spot all over my face. I feel so bad about that. Since last May to June, I came to this unit. They gave me acupuncture. That's quite different from dermatologists. Dermatologists gave me only hormone drugs, but this unit gave me acupuncture and Chinese herbal medications. That brings me so happy and amazing medical effects. You can see that there's no any mark on my face. Everything is much better than before.
Hola, mi nombre es Antonia Aquino. Tengo 58 años de edad y mi razón de estar grabando este video es para que los planes esenciales cubran más la acupuntura, que es una medicina que alivia el dolor para reducir, estar tomando medicamentos. La acupuntura es una medicina china que ayuda al dolor crónico, y necesitamos que Nueva York tenga un plan que cubra la acupuntura.
I don't